and pain, suffering, or interruption of the whole process sets in. If a patient is cold, if a patient is feverish, if a patient is faint, if he is sick after taking food, if he has a bed sore, it is generally the fault not of the disease, but of the nursing. What nursing ought to do. I use the word nursing for want of a better. It has been limited to signify little more than the administration of medicines and the application of poultices. It ought to signify the proper use of fresh air, light, warmth, cleanliness, quiet, and the proper selection and administration of diet, all at the least expense of vital power to the patient. Nursing the sick, little understood. It has been said and written scores of times that every woman makes a good nurse. I believe, on the contrary, that the very elements of nursing are all but unknown. By this I do not mean that the nurse is always to blame. Bad sanitary, bad architectural, and bad administrative arrangements often make it impossible to nurse. But the art of nursing ought to include such arrangements as alone what make I understand by nursing possible. The art of nursing as now practised seems to be expressly constituted to unmake what God had made diseases to be, namely, a reparative process. Nursing ought to assist the reparative process. To recur to the first objection, if we are asked, is such or such a disease a reparative process? Can such an illness be unaccompanied with suffering? Will any care prevent such a patient from suffering this or that? I humbly say I do not know. But when you have done away with all that pain and suffering, which in patients are the symptoms not of their disease but of the absence of one or all of the above-mentioned essentials to the success of nature's reparative processes, we shall then know what are the symptoms of and the sufferings inseparable from the disease. Another, and the commonest, exclamation which will be instantly made is, would you do nothing then in cholera, fever, etc.? So deep-rooted and universal is the conviction that to give medicine is to be doing something, or rather everything. To give air, warmth, cleanliness, etc., is to do nothing. The reply is that in these and many other similar diseases, the exact value of particular remedies and modes of treatment is by no means ascertained, while there is universal experience as to the extreme importance of careful nursing in determining the issue of the disease. Nursing the well. The very elements of what constitutes good nursing are as little understood for the well as for the sick. The same laws of health, or of nursing, for they are in reality the same, obtain among the well as among the sick. The breaking of them produces only a less violent consequence among the former than among the latter, and this, sometimes, not always. It is constantly objected, but how can I obtain this medical knowledge? I'm not a doctor. I must leave this to doctors. Little understood. Oh, mothers of families, you who say this, do you know that 1 in every 7 infants in this civilized land of England perishes before it is 1 year old? That in London 2 in every 5 die before they are 5 years old? And in the other great cities of England, nearly 1 out of 2. The life duration of tender babies, as some Saturn-turned-analytical chemist says, is the most delicate test of sanitary conditions. Is all this premature suffering and death necessary? Or did nature intend mothers to be always accompanied by doctors? Or is it better to learn at the pianoforte than to learn the laws which subserve the preservation of offspring? Macaulay somewhere says that it is extraordinary that, whereas the laws of the motions of the heavenly bodies, far removed as they are from us, are perfectly well understood, the laws of the human mind, which are under our observation all day and every day, are no better understood than they were 2,000 years ago. But how much more extraordinary is it that whereas what we might call the coxcombries of education, for instance the elements of astronomy, are now taught to every schoolgirl, neither mothers of families of any class, nor schoolmistresses of any class, nor nurses of children, nor nurses of hospitals are taught anything.